Hello, I am Dr. Shivani Chandan, consultant obstetrician and gynecologist at Aster RV Hospital, Bangalore. Today I am going to discuss a very important topic, that is about safe termination of pregnancy. We see a lot of patients who take tablets over the counter or don't know how to go about with termination of pregnancy. So here we are going to answer all the queries so that you can have a safe termination. The first most important thing is that prevention is always better, but sometimes accidents do happen and you may conceive. And family planning is something which is very important, and there may be certain reasons why you cannot continue the pregnancy. In such cases, it is very important for you to consult us rather than take medications over the counter. So when you consult us, we look at the history. Let me tell you here that it is very simple to diagnose a pregnancy. You can do a simple urine pregnancy test, which is very sensitive, and you don't have to do it only in the early morning sample. You can do it any time in the day. So once your pregnancy is diagnosed, it is very important that we look at your history. Do you have any medical problems, or do you have previous history? Have you undergone a cesarean or a previous normal delivery? And then we need to examine you and confirm the location of the pregnancy. Sometimes the pregnancy may not be in the uterus and it may be outside the uterus, which is called ectopic pregnancy. Such cases cannot be treated with medications. So once we confirm that it is intrauterine pregnancy, and if it is an early pregnancy, it can be medically terminated. Now there are two modes of termination. One is medical and surgical. If it is a very early pregnancy and up to 9 weeks, we can medically terminate it. And this involves two different types of medications, which will be told to you how it has to be taken, and how the bleeding starts and the pain starts will be explained to you. If you choose the surgical option, the advantage is that it is done, it's painless because it is done under anesthesia, and we finish it, it's a single procedure wherein, it's a daycare, we do it in the morning and you get discharged by evening, right? So if you're choosing a surgical option, the other advantage is that sometimes we can insert a contraceptive method such as a copper T or an intrauterine device right after the procedure. It is very important that we don't end up with infections during either the medical or the surgical termination, and that is why you have to consult us so that we give the right medication, the right antibiotics, and make sure that the bleeding is under control. Sometimes when you take these tablets over the counter, we have patients running to the emergency with profuse bleeding, and they require unnecessarily surgical interventions. That is why it is important for you to know what are the options you have, what is the safest method for termination, and try that particular method.